TAAAC is the Toronto Addis Ababa academic collaboration, and what they're trying to do is help the Ethiopians meet their objective of increasing the number of educated Ethiopians that stay in their country. And so it's one of the mandates to increase the number of postgraduate students in Ethiopia. And so our collaboration is involved strictly with postgraduate students, so masters and PhD, or residents in the Faculty of Medicine in their education. And if we can do this, as we've seen in numerous other developing world countries, increasing the education of the population is the key to success. And their country is strongly committed to it, and I think University of Toronto appropriately recognized that. Our role is to go there as a department and be teachers, and it involves 2 staff from the University of Toronto hospitals and 1 senior resident or fellow. And we go there and teach residents in Ethiopia just like we do every day here. Along the way, they recognized they needed to have physicians trained to provide anesthesia and began a residency program. But, you know, they had 4 teachers in the main teaching hospital, 10 operating rooms, an intensive care to run, a labor and delivery unit to provide services for. So really they were spread very thinly and couldn't very much be teachers, let alone be in every place. So the anesthesia residents are not just providers of care in Ethiopia. They really are the leaders of anesthesia services, and there's very few of them. I think to date there are 17 anesthesiologists in Ethiopia, a country of 80 million or 90 million now. So these people are very, very valuable. They are the teachers for nurse anesthetists, the administrators for anesthesia services. They are in the intensive care specialists in their country. So as many as we could train, they could use 10 more. So all we're trying to do is increase their numbers and have these people stay in Ethiopia. Getting involved in the project has a lot of places depending on where the participant is in their life. Typically, we have staff anesthesiologists who are either just finished and don't have children, or else people such as myself whose kids are grown up and can kind of get away for a month and not worry about their own family. Obviously for the residents, that's a method of participating if you're a trainee. It's a senior resident that goes because they'll be teaching independently with residents there, so they have to be somebody that's comfortable and flexible. But even here, you know, if some people are very interested in being involved and aren't at the stage where they can go away, but there are lots of issues here that they can get involved with at the TAAAC, whether it's, you know, in sort of governance and policy development, research, proposal reviews. So there's a lot of ways people can get involved, even just donations if they're interested in believing it's a good project. I wanted to get involved in something that was a little bit beyond me, say just going over and giving anesthesia services to women in labor and delivery and then coming home. So this really spoke to me because it was a project that had sustainability, was involved in a systems change, so we were focusing on training teachers. And in some indirect way, I'm helping maternal health because whenever I go there, I work in labor and delivery. So when the residents are with me, we're, you know, learning about that, and I'm teaching them about that. So hopefully they will change the maternal health in their country. And that's how I got involved.